During the COVID-19 pandemic, we have seen some important changes in our practice, especially treatment of multiple myeloma patients. We know that based on the evidence, based on some publications, based on experience from different centers, the myeloma patients were extremely vulnerable to this COVID-19 infection. And obviously, you need to decrease or minimize the risk of infection in these patients. So you need to avoid any circumstance that would favor COVID-19 in these patients. And this is why one way to protect these patients is, for instance, to move from IV treatments where they need to travel and go to the hospital to oral treatments administered at home. This has been something that many centers have used at least on a temporary basis until things improve. And we have actually already some nice oral agents in multiple myeloma. We have the IMiDs, thalidomide, lenalidomide, pomalidomide. Protease inhibitors, we have ixazomib, very well tolerated, once weekly oral administration. We do have other agents like HDAC inhibitors, which are oral. We have selinexor coming. Cyclophosphamide is an oral drug. So when we look carefully to the different combinations we used in multiple myeloma, whether in the front line or whether in the relapsed setting, actually in a situation of crisis like what we have seen recently, it is possible and likely effective, actually. There's no harm to the patient to switch into oral combinations because these oral drugs are quite effective. Safety has been established, and we do have a lot of trials showing the beneficial effects of these drugs. In general, oral drugs also allow for an improved quality of life, at least for majority of the patient. So I think we have to transform this, I would say, sad COVID-19 pandemic into something positive and analyze what are the changes we have been able to do and see how we can use them to further improve the outcome of our patient, to further facilitate the way we deliver therapy, and obviously at the end of the day, to improve their quality of life, to improve their survival.